I imagine that right now you're feeling a bit like Alice, tumbling down the rabbit hole.
I don't like the idea that I'm not in control of my life.
I know exactly what you mean. Let me tell you why you're here. You're here because you know something. What you know you can't explain, but you feel it. You felt it your entire life, that there's something wrong with the world. You don't know what it is, but it's there, like a splinter in your mind, driving you mad. Do you want to know what it is?
Pharma.
It is everywhere. It is all around us. Even now, in this very room. You can see it when you turn on your television. You can feel it when you go to work, when you go to church, when you pay your taxes. It is the world that has been pulled over your eyes to blind you from the truth. You are a slave. Like everyone else, you were born into bondage, born into a prison for your mind.
Hello, welcome to Thrive Alive. I'm Dr. Barry, and today we're going to be talking about, something doesn't feel right. I'm Agent Pharma. America is diseased with chronic illness, addiction, and plagues. And we have the cure. You're not here because you're free. You are here because you are not free. You hear that sound? You're probably thinking it's the sound of inevitability. And it is. The inevitable sound of cha-ching in our pockets. Okay, enough fooling around, because this is no joke. Today I'm going to be sharing with you the shocking truth about our healthcare system and how it's impacting your life every day. Stick around. Our healthcare system is in a crisis, and it has been for decades. Nobody talks about it, and when revealed, are often cast aside as ridiculous and ignored. People rush to the ER, urgent care centers, and their primary care providers, blindly wasting hours of their precious time waiting for drugs and procedures that are more often than not unnecessary and endangering their health even more. The condition of our nation's health and our healthcare system has become so critical that it threatens our very lives. We are spending more and more money each year on the care of health, yet the American public is getting sicker and sicker. According to Nancy Dickey, MD, former president of the AMA, the American Medical Association, she said,
that I'm concerned about our healthcare delivery system. And if you look at its vital signs, then you should be concerned as well. The current system leaves feeling dissatisfied, frustrated, and angry. We haven't gotten it right yet. Our system is out of balance. It's a mess.
She said this in December 1998. According to the World Health Organization, in 1999, healthcare costs escalated to over $1.2 trillion in the United States, with projections of over $2.2 trillion by the year 2008. In 2023, just last year, healthcare expenditures in America alone were over $4.7 trillion. That is 5.5 times more than our defense budget, which is $858 billion. With all this spending in healthcare, why is the incidence of degenerative and chronic disease just keep going up? In 1994, it was reported that over 35% of the American public suffered from chronic disease. This has escalated to over 60% in 2022, according to the National Association of Chronic Disease Directors. This accounts for over 70% of all deaths and 90% of all healthcare expenditures in the United States. The United States supposedly has the finest healthcare facilities, the best trained doctors, and the latest cutting-edge modern technology available in the world. Yet the American healthcare system is ranked 69th on the World Health Index. That is between Armenia and Algeria. The contradiction is readily apparent. By the way, in 1999, the American healthcare system was 24th. Things are only getting worse, much worse. Let's look deeper. According to Johns Hopkins University, every year, 371,000 deaths and 424,000 permanent disabilities are reported as caused by medical errors. This is equivalent to 2 jumbo jets crashing every day. Why isn't this front page news every day? Let's put this in perspective. So the 2023 reported medical error deaths was 371,000. In the same year, reported gunshot wounds, 18,874. Reported drug overdose deaths, 96,000. 70% of which, by the way, were opioids. Reported auto accident deaths, 3,331. While we're on the topic, let's talk COVID. According to the CDC, the total current number of COVID deaths in America is approximately 1,100,000. But it's funny. On another CDC page, they state that only 6% of these deaths were actually caused by COVID. 94% of the deaths were due to other pre-existing conditions, so that these people didn't die of COVID, they died with COVID. So 6% of 1,100,000 is 66,000. Let's add that to our list. So total COVID-caused deaths, 66,000. If we total these all up, actual COVID deaths, gunshot wounds, overdose deaths, automobile accident deaths, they total 184,205. That's half of the number killed by medical errors every year. Are you feeling outraged? Are you feeling shocked? Are you feeling frightened? If not, why not? These are the facts. And if you think it's bullshit, you know how to Google. Check for yourself. So why is this allowed to go on? Why is nothing being done about it? Why is it actually being hidden from the masses? Money. Your money. $4.7 trillion of your money last year alone. Let me show you another perspective. In 2007, the National Institute of Health released a 7-year study trying to disprove alternative natural therapies as ineffective in relation to allopathic medical care. Unfortunately for them, this study backfired because what they found was that people whose primary care provider was a chiropractor, an acupuncturist, or some other alternative practitioner took 85% less pharmaceuticals and had 60% less hospital visits. I'll repeat that. People whose primary care provider was a chiropractor, an acupuncturist, or some other alternative practitioner took 85% less pharmaceuticals and had 60% less hospital visits. So what would happen if everyone left the hospitals, left their medical doctors, and sought out a chiropractor, an acupuncturist, or some other alternative practitioner as their primary care provider? They would lose lots of money. 85% of their money, according to this National Institute of Health study. Is it any wonder that you can no longer find the study anywhere online? You have to really dig deep to find it. Let's do the math and see what they would have lost last year. $4.3 trillion times 85% equals $3.995 trillion. They would have lost, and our total healthcare expenditures would have been only $705 billion. Only. What great things could we have accomplished with an extra $3.995 trillion? Big Pharma doesn't like this. The insurance industry doesn't like this. The hospital industry doesn't like this. I will add one disclaimer. If you have a bone sticking out of your arm, if you are in a life or death situation, go to the hospital. That's what they're great at. They will save your life. That's the 15% they should be earning. Talk to your medical doctor. Ask them, do you have any solutions for eliminating my chronic disease? Do you have any solutions for helping me achieve optimum health? Do you have any solutions for helping me get off of medications and live a vibrant, healthy lifestyle? That's not their expertise. The chiropractors, acupuncturists, and alternative therapists, that's their expertise. And I don't even like using the word alternative practitioners. Is a screwdriver an alternative to a hammer? No, they're different tools. They have different functions. I prefer to call it wellness practices. Medical care and wellness practices are two different tools. Use them appropriately. If you're still watching this video, I really want to thank you for joining me today. I started talking about this stuff 30 years ago when I wrote my book, A Clear Path to Healing. And more often than not, people either blow it off as ridiculous, laugh, or they're just so shocked by it, it won't even sink in. I hope it sinks in for you today. And if you'd like to take that first step to break out of this healthcare matrix, watch my last video. I talk about the cause of all disease, and I give 10 strategies for achieving optimum health. If you have any questions, leave comments below. Ask them, I'll respond. And if you think I'm totally full of shit and this totally infuriated you, and you comment also. I'd love to see all points of view. Again, thank you for joining me today, and I'll see you next week for our next video.